Now, healthcare consulting and advisory firm Simega Health says more employers are ditching compulsory medical aid scheme membership for their staff. Simega also flags that an increasing number of younger people are deferring medical aid purchases until later in their careers. For more on this, we're now joined by Simega Health Managing Director Mbali Khumalo. Mbali, very good evening to you. Thank you so much for your time. You're concerned more and more people are moving away from medical aid membership. Talk to us about some of those concerns.
Good evening, Paul and the listeners. Yes, we are very much concerned, and the concern is really because the longer you defer joining medical scheme, the more expensive it becomes. And we're seeing the cross-subsidization between the young and healthy and the old and sickly diminishing, which pushes the pricing of medical aid higher and higher. And the other thing is that if you join later, then you have late joiner penalty imposed. And late joiner penalties can be anything between 5 and 75%. And that is a lifetime loading. So if you are loaded with 75%, you will pay a premium that is loaded with 75% for the rest of your life.
You speak about younger people not necessarily committing themselves to a medical aid scheme, but the reasons could be many. For instance, just before you and I spoke, we were looking at the country not yet out of the woods, according to economists, when looking at how the country has essentially escaped a technical recession. But some problems of that nature may also perhaps be one of the reasons why younger people are moving away from opting to go with medical aid schemes. They may say, I can't afford it, and I'm young and healthy anyway.
Yes, that is most definitely the reason we are seeing. So there's a lot of financial pressure. Affordability is a huge challenge, and we know that most of our youth is unemployed. So most of them are unemployed, but the little that is employed is deferring it. And the financial pressure is from two angles. It's both from the youngsters as well as the employers, because the employers are moving away from guiding or subsidizing medical aid now, which was a tradition 10 years ago, and it has now changed. And employers moved towards cost to company, and they will give you your total guaranteed pay, and how you give it, it's up to you. Initially, participating was still more compulsory at the time, and now we are seeing the slow shift to it being voluntary. And with the financial pressure, the minute you give an employee total guaranteed pay and you say you're going to decide how much you put for retirement, for medical aid or whatever, and you say medical aid is voluntary, they see an opportunity to increase their take-home pay. Therefore, they just ditch medical aid, because it doesn't work. But we're not thinking of the impact far down the line, because when you participate, and what we are saying is that employers, if they dish medical aid, at least put some primary healthcare solutions in place. You can have a primary care, a clinic on site, employee assistance program, a nurse on site, something in place to help and your employees to prevent contracting chronic diseases, because prevention is the best thing. And if they already have a condition, at least then if it's managed, you can arrest it from getting worse.
I suppose the biggest concern, I mean, you speak about wellness, which is of huge concern, and the biggest concern could be the stagnation of the medical scheme population in South Africa. I mean, we see it going down over the decades, well, just in the past decade. And that in itself poses a danger to the industry. Yeah,
most definitely. It does. And it's even worse in the younger population, between 20 and 34 years. It's even, when I looked at our own data, and our partner Afrocentric, they administer 3.8 million lives. And of that, only 2.8% are voluntary young participants between the age of 20 and 34. So it's such a small percentage. And if you extrapolate that to the total population of medical scheme, which is 8.9 million, it's only about 250,000 beneficiaries, which equates to 106,000 principal members. So only 106,000 youngsters between the age of 20 and 34 are volunteering in South Africa to participate in medical aid. And we know that our public sector is not doing well. It's under a lot of pressure. So you can't say that, no, I opt for the state solution, because NHI is not here yet. And it's still going to be a long time until you see NHI come into play.
And it could worsen, of course, under NHI, which is also another big concern for the industry.
It is.
So looking at, I mean, you speak about options that employers could opt for employees. You speak about primary care, which would speak to a more attractive price range for those who are looking at it and saying, I can't afford this. It's not one of my priorities, because medical aid is expensive. It really, really is an expense on families. How are you diversifying and making the options accessible to especially the younger cohort that you speak of being of concern?
Okay. The industry has come up with quite a number of options. So there's primary care that I'm talking about, which is nurse on site, and there is primary health care insurance, which looks very similar to the medical aid, but it's not, because it doesn't give you hospitalization. So you still get your access to your day-to-day. So you get your day-to-day benefits, you get your chronic, you get the emergency, you get accident. But the emergency and accident, you will be taken to a private hospital just for stabilization. And after stabilization, you get transferred to a public hospital. So that is an option. It's quite reasonable, but you need to understand when you take that option that you don't have hospitalization. You will not get tax credit, which is an advantage of participating in a medical aid. So people need to understand those differences and those nuances, because we come across a number of people who think they have a medical aid if they have a primary health insurance, which is not actually the case. And when an event happens, they expect to be admitted in a private hospital, and the hospital tells them, no, we can't admit you. You don't have cover. So there are those options that are available.
Yeah, and in closing, before we let you go, I mean, what would you say to people who are still skeptical when opting for a medical aid scheme? What would you say to encourage them and in exploring the importance of having medical aid in South Africa, especially looking at the current health system?
It's honestly to say we understand the financial pressures, and you need to make an informed decision when you take any decision. If you cannot afford what I just mentioned, the primary health insurance is one solution. But employers also have a role to play in providing some sort of a solution for employees. And saying that you are going to use the public facilities is really not an option in our country. And you need to understand that the more you depend on that system, if you are sick, it's a day out of work, and it's a day of productivity that is lost. And you need to take care of your health and your wellness to make sure that you take preventative measures. You can do things like living healthy, wellness, nutrition. Smoking is one of what we call a big four. Physical activity, nutrition, smoking, and alcohol abuse is 65% of healthcare expenditure. And it causes 80% of the non-communicable diseases deaths. So it's all those things that people need to take into account that you're not quite aware of. And if you do the right thing, even if you don't have money, you can prolong your life, you prolong living healthier for longer.
Yeah, very well. Thank you so much. Thanks for your time.